Welcome to Face the State. I'm Ariana Bennett. Thank you for joining us. When you're looking at the health of a community, it's not just a matter of having good doctors or healthy diets. There are dozens of factors that contribute to how long we live and how healthy we are during that time, from exercise to education. And a recent study took a detailed look at those factors here in Washoe County. Now, Washoe County District Health Officer Kevin Dick is here now with me to talk about those findings. Kevin, thank you so much for being on the show.
Well, thanks for having me on the show.
Okay, so this report, they do it every year, right? The county health rankings from the Robert Wood Johnson Foundation.
That's correct.
So do you guys kind of eagerly anticipate the findings every year?
Well, we kind of do, because it's an opportunity to get people together to talk about those results and what they mean within our community.
So how did you generally feel about what it found for Washoe County this time around?
Well, I think one important thing to remember with the way they do the rankings is that it's a ranking of counties within the state of Nevada. So what we're looking at is how does Washoe County stack up against the other counties in Nevada. We can look at sort of how that relates to the U.S. as a whole, but that's not the way the ranking's done. So I just would put that as a preface. If we talk about how we're doing, it's just within the state of Nevada, within those rankings.
Absolutely. Okay, now it breaks it down into kind of two separate halves. It's the health outcomes, so like the length of people's lives, and then health factors, things that contribute to the length of people's lives, right?
Yes.
And Washoe County did pretty well.
Yes, we did.
Both of those.
We ranked 5th in the state for health outcomes. That's a measure of how we're doing right now when you look at the death rates and the health of the community right now. The health factors, we ranked number 3 in the state. And the health factors is really more of a forward-looking measure based on the physical environment that we live in, the clinical care that we have available to us, the social and economic factors that we have. How are those going to impact our lives, and how do we stack up there?
Right. It is probably, at least in my mind, the most comprehensive look at the overall health of a community I've seen, which is why I wanted to come on here and talk about this and kind of break it down a little bit. Just looking at, I think I'm just going to start at the top because there's so much to get to, but the factors that it looks at, basic ones that you'd expect, like obesity, for example. It did find that Nevada and Washoe County do, relatively well, at least in comparison to the nation, and Washoe County is a little bit better than Nevada, but it's been going up over the years.
Yes.
What role do you guys have, where that's
So obesity is an area that we have focused within our chronic disease program on. And we do fairly well. It's about 22% is our rate of obesity in adults, which is better than the national average and better than the state.
Right.
But we're also in the most overweight and obese country in the world. And so just to be doing better within that context is not a great thing, and we know the impacts that obesity and lack of physical activity have on people's health. So even if we have a low number, we're still going to be striving to work on that and keep that rate down or reduce it. We've been working with the schools on their wellness policy. We have a program going with the Truckee Meadows Healthy Communities, a coalition we work with, and the food bank is the lead in a project under Feeding America and the Arnold Foundation, where we're looking at food insecurity and the root causes of that. And so that poor nutrition is a major factor in overweight and obesity.
I mean, despite a pretty big push, I think, over the last 5-10 years to increase education and everything about healthier diets and better habits to decrease the obesity rate, it's still going up. I mean, across the board, but also here in Washoe County. Do you have any guess as to why?
Well, it's really linked to social and economic factors that people are living in. And we have in Washoe County 19% of our population is in poverty. We have 25% of our children live in poverty. And so if you've got limited funds available, or if you're on the SNAP food stamp program, and you've got $1.50 to $2 for a meal, the tendency is to go for high-calorie foods, right, because you want to get filled up. And so there are those factors that are driving some of that overweight and obesity rate. There's also the behavioral factors and the convenience. we look, when we did a community health needs assessment recently, and we looked at areas that are food deserts where people have to go more than a mile if they're living in poverty to get to a store, and that's difficult. But we also have food swamps. And you look around when you're driving around and you'll see these corners where you've just got all of these fast food outlets all clustered together. And it's easy to get in there, get a quick meal, and move on. And so that's a lifestyle thing as well.
Especially now when we see the number of hours being worked by the average professional person going up, you know, the amount of time you have to grocery shop and cook is going down. Sometimes you just have to grab food when you can get it, and the fast food, it's everywhere.
Yeah. I don't want to be all negative though either. You look at the farmers markets in the area. We've seen a big increase in locations and availability of fresh produce through farmers markets over the last few years. I think that's going to be a growing trend that we've got in the community. So there are definitely some great things going on as well.
Right, and another positive feature that, you know, the study kind of pointed out was that physical activity and access to places where people can be physically active are both really good here in Washoe County and across the state of Nevada. And I think that probably contributed to Reno being named one of the fittest cities recently, which is pretty exciting.
We have a great outdoor recreational environment, and we really just about hit it out of the park on the rankings. When you look at the access to outdoor recreational opportunities, I think we scored about 92% on that, and the U.S. average was 62, 63, something like that. So we do have great opportunities, and people understand that and appreciate it, and I think that helps contribute to people leading a healthy lifestyle here.
Yeah, helpful to have good weather too. It's hard to make excuses not to go out and be active when we have beautiful weather like we're seeing right now.
And even when we've got bad weather, we sometimes get good snow, and so it's another reason to get out. Absolutely,
good point. Okay, the next thing on there that I wanted to talk about was smoking. Nevada was actually a little bit lower than the nation overall, which surprised me a little bit. Washoe even lower than that. What kind of programs have you guys had to kind of encourage smoking cessation?
Well, we've been working with promotion and education. Currently, we're running a campaign on smoke-free housing, and we've been working with multifamily housing apartments to become smoke-free, and that provides great opportunities for avoiding secondhand smoke. So we have been seeing a decrease in smoking rates of the tobacco products, but we're concerned because we're also seeing a big increase in vaping rates.
Right.
And I just looked at one of the print publications recently, and they've got a cover on the vaping subculture that we have going on. And there's a lot of unknowns really about the health effects of vaping. It definitely has nicotine in it, and so people are becoming addicted to nicotine, and our fear is, and studies have shown that youth that are vaping have a higher likelihood of moving to cigarettes. So while I'm encouraged with the rates we have, our concern is maybe there's a ticking time bomb here, and we're going to see more people move into cigarettes in the future from the vaping craze.
Do you find that most people are under the impression that vaping is definitely a healthier choice than smoking traditional cigarettes?
I think that people do, and people I think are under the impression that vaping is a good way to quit smoking cigarettes. But I want to point out that it has not been approved as a smoking cessation method. There's no scientific evidence to support that. So I'd recommend if somebody wants to quit smoking, call the quit line, 1-800-QUIT-NOW, and they can get assistance and counseling in how to do that. And they can also get free help with nicotine patches and approved cessation methods.
Free?
Yes.
Oh, good deal. Yeah, people like free. Okay, still though, at 16%, is there a goal to drop that number to a certain level?
I think we want to just continue to see it go down. Obviously, 0 is going to be the best level. But I think it's not only the people that are smoking, but it's the people that are exposed to secondhand smoke. And so at Washoe County recently, we had a new policy that was adopted that prohibits vaping the same way as cigarette smoking inside and in vehicles, but also will be designating only specific locations on the county complex that staff will be able to smoke. And I think when we look more broadly in the state, we see a situation where we have lots of space under the Clean Indoor Air Act in the casinos where people are still allowed to smoke, and we have a workforce that in order to have a job and make a living, to hopefully put a healthy meal on the table for their families, are being subjected to secondhand smoke, right, just to try to make a living.
Yeah, and secondhand smoke is dangerous. It's not a mild thing. I think a lot of people don't realize how many health conditions are directly connected to secondhand smoke.
Yes, and the rate of cardiac incidents goes up dramatically with people that are exposed to secondhand smoke.
Yeah, scary stuff. Okay, call the quit line. Got that. All right. Now, something that was pretty eye-opening, I think, about this study was what it found an area in which Nevada and Washoe County are off the charts high, and that is excessive drinking and DUI deaths. Really, really high. Do we have any idea why this is?
Well, people should understand that Washoe County has the highest alcohol consumption and binge drinking rates in the state of Nevada, and we're a 24-hour state. So this is something that's definitely got our attention. But I think that beyond alcohol abuse and overconsumption, just substance use and abuse is a big issue that we have across the country, and one that we have identified that we are working to address and become more involved with it through the health district. And while we may not be directly through our programs the agency that's delivering those direct services, we want to work with partners in the community and with the state to expand our investment and our capacity to work in those areas. We recently adopted a community health improvement plan, and that does look at both alcohol consumption rates in the high schools and at UNR. And so we have some targets of trying to get some reductions there, which will hopefully get us moving in the right direction. But we also need to be looking at other substance abuse. We have this opioid epidemic that's going on. And so people not only with the pain killers that they get addicted to, but then moving off of those to heroin because it's cheaper to buy than the pharmaceuticals. And so drug overdose is also a big factor in Nevada.
Interesting to me. I mean, I know the 24-hour nature of the state contributes to all of that, but I mean, still the numbers were staggering. I mean, we're looking at averages of 3 or 4 times the national average for binge drinking and DUI death. How specifically do you get a population to cut back on drinking, especially college students? Not to be a naysayer, but it is kind of part of the college culture. Well,
it's a behavioral health issue, and there's a term that the Robert Wood Johnson Foundation has coined, and that's a culture of health. And we've been working with a lot of partners and other organizations throughout the community to move toward a culture of health in Washoe County, where we recognize what a healthy community is and what the benefits of healthy lifestyles are for us. And it's not just I think we need to recognize it's not just an individual healthy lifestyle that's benefiting that person, it's benefiting our economy and our economic development as well. And so we need to work together as partners to do that. I think the other piece to understand is that substance abuse is also closely tied to mental and behavioral health. And so people are oftentimes using a substance in a way that they're self-medicating because they have mental and emotional problems that they're dealing with, but not dealing with effectively if they're using alcohol or some other drug to address that. And so we want to also expand the opportunities for mental health counseling and for wraparound services for people to help them deal with the issues that are causing them to use substances.
In order to do that, do you have the money in the budget, or is this going to involve getting more money from somewhere?
We don't have the money in the budget, and mental health is a huge issue for the state. There are some investments that are being made with some social service counselors that are going to be available through the school districts, and there are some great projects that are going on in the community to be creative and innovative in how we're addressing those issues. But it's going to take moving the needle, and it's going to take investment. And I'd like to, I think it's just really important for us to remember that it's costing us money now. It's not a matter of the only cost being what we're investing in public health and in mental health in the state. We're paying on the back end because we're not working on the front end on those issues. And Nevada's 51st in the nation in their investment in public health. And so we're behind the District of Columbia. I think we fall even further if you include the territories. And so I think public health is an area we really need to have the state be looking at as an investment that's going to save them a lot of money in other areas. Chronic disease, $20 billion per year it costs Nevada between the direct and indirect costs for chronic disease.
Wow. So we're talking changes in the legislature 2017 session.
Well, at least we can make some noise and start some thinking about changes. I'm not optimistic it's going to happen in 2017, but if we're not working in 2017, it won't be happening in 2019 or 2021 either. So we're already pushing on that issue.
Okay, all right, interesting stuff. Something else the study touched on that I want to just touch on real quick. Some factors that you wouldn't necessarily think contribute to the health of a community, like education and graduation rates. How do those affect community health?
It's huge, education, and that's one of the 4 priorities that we have in our community health improvement plan is improving the high school graduation rates, but also tied to that, improving the performance of those high school graduates when they go on to college so that they're not having to take remedial classes, so that the graduation really means something. But income level and poverty are such huge factors in people's health outcomes.
Right.
And so to the extent that we can educate our kids so they have opportunities for careers and decent paying jobs, then that is going to help them have a healthier lifestyle just because of not having to deal with the struggles of poverty on a daily basis. And so if you're struggling to figure out how you're going to pay your rent, you may not have money left over for food. If what you do have as far as securing your next meal, you're not going to be driven by making a healthy nutritional choice. You're going to do what you can do to get some food in your belly. And so there are some really some deep and some generational challenges that we're facing, and in working to address those, we're not going to change it overnight. But what we're seeking is commitment in our community to work together over a generational period to move the needle, so that we have people that are making a living wage and everyone has the opportunity to have a great life in this community.
Yeah, really kind of a holistic look at all the factors that contribute to a healthy community. All right, this is a perfect time for us to take a quick break, but Kevin, stick with us.
Okay.
Coming up on Face the State, I will be back with Kevin Dick to talk about other issues facing Washoe County's health, including what we all should know about the Zika virus. Stay with us.